right. Hello, everyone. My name is Elizabeth Ronan. I am the analyst with the Racial and Social Justice Department. My director, Denise Molina Capers, will be joining us. She's just having connectivity issues, so I'm going to start us off. So thank you so much for joining us for part 2 of the Public Safety for All informational series on alternative response models. If you could go to the next slide, Elijah. The goal of the Public Safety for All informational series is to raise awareness of current public safety efforts in Somerville, the city leadership who help provide public safety services, and to learn about public safety response models. And as a reminder, we ask that you honor the following community norms. First, speak your truth and use I statements. Respect everyone's opinions. Listen with an open mind and heart, and expect and accept non-closure. Lastly, we want to hold space for items that we would like to discuss, but we don't have the space to do today. So we call that the parking lot. If something comes up or a question comes up that we don't have the space for today, we will parking lot that item and come back to it at a later date. All right, Elijah, all set with the slides. So in our first session, Stephanie Guirand laid the foundation for 3 out of the 4 alternative response models. Among them, we examined the hub model, the violence interrupter model, and the mobile crisis response model. Stephanie presented us with information about when the model intervenes in public safety matters. She identified which individuals coordinate the intervention and who is served by the intervention. And lastly, the location in which these interventions are facilitated. We accepted questions from participants and posed them to Stephanie during the presentation and also at its conclusion. Today, we will build upon this information, but also explore the 4th alternative response model, which is the targeted population intervention model. I'd like to take this time to welcome Stephanie Guirand again to facilitate the rest of the presentation on alternative response models. Thank you so much, Stephanie, for joining us, and feel free. I will give you the ability to share your screen and we can get right into your presentation.
Right, thank you very much.
Like I said, we will be receiving questions from participants, so feel free to use the Q&A feature to ask questions, and I will pose them to Stephanie.
All right, I'm just pulling up my presentation now.
Thanks, Stephanie.
Okay, can you all see my screen? Okay, I hope that is okay.
Looks good on my end.
I'm having trouble seeing my notes. I'll just have to pull them up on my phone. Oh, here's Denise.
Hi, Denise. I introduced everyone to Stephanie and spoke about what we'll be talking about today. Let everyone know that you were having connectivity issues and that you'd be on in a minute. But everyone welcome Denise Molina Capers, the director of the Racial and Social Justice Department.
Thank you.
Right. I have to stop sharing my screen. I need to figure this out. Sorry.
Technological issues get the best of us.
Yeah, seriously. Okay, I don't know if this is going to work. may end up being a little bit smaller just so that I can see my notes. Okay, can you see my screen but small? Okay. Is this okay? Is it too small?
That's okay on my end. When you zoom in, I can't see all the text that's on the screen.
There, just make
So
it
you
a
might
little-
just have to scroll up and down a little bit.
Is that okay?
I can see everything now.
Same.
It's still not working for me. I'm just gonna hit present and then pull it up on my phone. I apologize. Okay. Sorry for that.
Thank you, Liz, for getting us started. Stephanie, again, I would like to welcome you as well. I don't know if you can pin me, Liz. Thank you. So good evening, everyone. My name is Denise Molina Capers. I am the director of the Racial and Social Justice Department. Apparently, we've been having internet issues everywhere.
Yeah.
So I apologize. I am currently on my mobile hotspot. So if I get kicked off for the third time, I will be sure to jump on. But Stephanie, please feel free to continue if I do get kicked off, because this is all about your expertise and the wisdom that you are sharing with us as a city. I will be mindful to pay attention to constituent questions that may
I
come.
think that's her getting. Oh, you're back.
Can you hear me? Yes, okay. I'll be mindful to check when constituent questions are coming up, and if it's relevant to the section that you're in, I'll raise the question. If not, I'll wait until a better time to ask the question. But the floor is yours, and we are excited to continue part 2 of our building knowledge around other emergency models that the city could potentially implement.
Right. Thank you very much, Denise. And I'm so sorry for the technical difficulties. Right. In our last session, we went over 3 models and we talked about some existing organizations and what they do and how they approach specific types of interventions. This time, we're going to go over an approach to designing an intervention called the targeted population intervention, and thinking of that as a model. Rather than beginning at a definition or giving examples of what targeted population intervention models do, I'll begin with some examples of organizations and initiatives that target population through their interventions. For example, the Material Aid and Advocacy Program in Cambridge, Massachusetts, so just next door. And they also operate in Somerville. So I encourage you to seek their wisdom. They have a holistic approach to building community and allocating resources among people who survive poverty in public. And in that capacity, they do everything from having materials that people need in order to survive poverty in public, as well as such as food and clothes and tents. And they also advocate for what their community members need and ask for, such as safe consumption sites, which Somerville has been in discussion about, harm reduction materials like drug testing strips and clean needles, and they do so much more. I really encourage you all to invite them to come speak about their work and to give suggestions about some of the best ways to support people who survive poverty in public. There's also creative interventions, which, unlike the other models that we've talked about that do direct intervention work, what they've done is compiled a number of different approaches to address specifically interpersonal and sexual violence. Their work focuses on domestic and interpersonal violence, and they've tracked and outlined activities and alternative interventions to addressing interpersonal violence. They've published these approaches in a massive book. I think it's over 500 pages. It may be bigger than that. I also recommend that the city of Somerville invite Mimi Kim to come speak to discuss in depth the different approaches that Creative Interventions has published on. I recommend that you take a look at each of these different organizations outlined on this slide, especially the Compassionate Alternative Response Team, CART, which is based in San Francisco. I named CART, but I also want to make sure we understand that what the city of San Francisco has done is that they've created 5 separate teams to address 5 separate issues that they've identified in their cities. I'm only in touch with 4 of them. I just wanted to be transparent about that. So CART in particular is designed to address the needs of unhoused populations in San Francisco, but they also have targeted interventions for folks who are experiencing substance use disorders. And they have an entire team that is a behavioral health mobile response program. And they make distinctions about addressing crisis and violence in public and in private. So I really encourage you all to take a look at some of these other organizations and learn about their approaches. And lastly, I'll highlight Generation 5, which specifically looks at, historically, they have looked at sexual violence, specifically child sexual violence. They have published reports on what needs to be considered in order to disrupt cycles of sexual violence between generations. And so I encourage you all to take a look at those resources. I will drop a link in the chat at some point with the links to each of these different organizations, their websites, so you can learn more about what they do. Great, so target population interventions, they involve first identifying an issue among a population. So I'll give this example that's outlined on this slide here. So let's take youth and violence. So youth violence, the population being youth and the issue being violence. The intervention requires a proposed solution. There should really be a process for identifying the proposed solution, but let's say there is a process and it yields a specific intervention. So for example, low take-up rates for year-round youth programs as the proposed solution. So when I say a process, I mean collecting survey data, interviews, focus groups, like a general outreach among the population that the intervention needs to address, to collect data on what the issue is from their perspectives, the stakeholder perspectives, as well as getting data on what they propose an intervention might be. Right. So if we're looking at low take-up rates for year-round youth job programs as a proposed solution, this presumes, of course, that there are year-round youth job programs as a pre-existing program in the city, and that the city collects data on that program and its take-up rates. So just naming that upfront as we go on to talk about this. So the intervention would need to address the issue of low take-up rates for youth jobs. So that's what the proposed intervention would need to do. And so the intervention would need to seek to increase take-up rates for year-round youth job programs. And there would need to be more discussion specifically with the designated actors of that program, of that issue. So obviously the youth of the communities and of course the youth job program administrators to sort of identify the specifics and the logistics of the issue of poor take-up rates. And then you'd need to conduct further surveys, interviews, and maybe even focus groups to determine why there are low take-up rates among this population. And perhaps the proposed intervention research process could yield poor communication or information doesn't reach the targeted youth population, right? And then the intervention would need to facilitate would need the facilitators to identify the actors to enact the intervention. So who's going to actually do the thing that's been proposed? And then obviously the city would need to allocate resources. That could be more promotional materials. So paying money for outreach to specific communities. They would need a clear and non-invasive monitoring and evaluation plan of the program. So how do we find out that the intervention is working? So the very clear ways to see if the intervention take-up numbers have gone up from the previous year, or we can create monitoring and evaluation plans that are even more specific than that, which I'm happy to discuss. And they need to repeat the process until the take-up rates are high enough that people feel satisfied with the results. And if the take-up rates are still low, the low take-up rates persist, there would need to be a process again to identify a different approach to targeting that population. That makes sense. No questions? Okay, cool. All right. So some population interventions some potential populations that can be served by alternative interventions. So, I mean, non-police interventions can include youth, undocumented residents, substance users, unhoused population, immigrant populations, formerly incarcerated individuals, government subsidized housing tenants, people who use violence, people who are surviving domestic violence, people in immediate crisis, and people living with disabilities. And just like the other models that we talked about, the same questions need to be considered. Will the intervention be community-led, police-led, service provider-led? Will it be a mobile response, or will it be a stationary response? And who will be the coordinator? Who will be the responders? And what will the temporal point of intervention be? So all of these questions need to be considered as part of designing a targeted population intervention.
Stephanie, we do have a constituent question.
Oh, okay, yeah.
Asking, what kind of data does a city need to have access to in order to determine target populations?
Yeah, I mean, that's a very important and interesting question. So I think there needs to be a process to determine what needs to be done in the city, right? So I named youth violence because it's an issue in Cambridge, and there needs to be an approach that directly intervenes in the continuation of youth violence in the city, right? So Somerville needs to have a process, and you all need to decide what are the issues, who are the people most impacted, and what does the intervention need to be? And so the process is really key. I made some suggestions for some people who might need intervention, but the next step with what I've proposed is making sure that we're in direct communication with people from those populations, people who organizations that serve those populations, in general stakeholders that are who are asking for these interventions on the populations that we're talking about. Does that make sense?
Yes, absolutely. So in my head, I'm thinking, the process of us doing the Public Safety for All study was very important because we're ahead of the game in terms of being able to have not just community feedback on what concerns they have and what needs they have, but also having gathered quite a bit of data on many different aspects of public safety in Somerville.
Oh, I don't know what that process yielded, but I think that's exactly right. Collecting that data and then analyzing it, making some recommendations, and then the next step is to go further into those communities and getting more information from the stakeholders about how to design an intervention that will actually make a dent in the issue.
Thank you. We have no additional questions as of right now.
All right. All right, next slide. Right. So on this slide, there's a non-exhaustive list of intervention types. So some things you might consider is, will this intervention be ending violence, which is what we proposed in the previous slide? Will it be addressing communication gaps between people, between government programs, between service providers, or all three? Will it be facilitating peacekeeping, conflict resolution, and training? Will it be coordinating safety planning, helping people with navigating social systems, help people disentangle complex situations and create safety plans? Will it address poverty? Will it attempt to increase civic participation? Will it help by transporting people? Transportation is a major crisis in the greater Boston area, especially as the housing crisis persists. Will it provide language access to non-native English speakers? Will it create a sense of belonging among Somerville community residents? Will it address trauma, perhaps post-conflict, or as a second or third response within a period of crisis? I want to name an organization that existed in the city of Cambridge but no longer operates. It's called the Cambridge Community Response Program. It operated from 1988 until about 2008. They sent community responders post-harm. So if there was a homicide in a community, they would send people to the community to support, to address mental health trauma as a response to the violence that took place in the community. So could it be a post-conflict trauma intervention, for example? Will it be a first aid intervention? For example, mental health first and medics, Ujima medics in Chicago, they train community members as street medics to address gun violence related injuries and the like. They also train people to identify different types of typical health signs, poor health signs and crisis signs. So someone who's a diabetic who has low glucose. So training community members to recognize those signs. An epileptic who is having a crisis. These sorts of things, they train community members to know what those signs are and what the immediate solution or the immediate issue that needs that warrants a quick intervention before EMTs can arrive on the scene. So they train community members to do those things. Or will it be material or financial assistance? I mean, Somerville really already has MAMAs, Medford and Somerville Mutual Aid organization. So there are a lot of resources in the city. It's a question of also making sure that these organizations are communicating with one another. Also, is it a question of making sure that people get access to the existing resources? So we need to have a conversation in the city about what the intervention needs to do. So it needs to focus on who it needs to serve, as well as what the interventions need to do. Right. So any intervention needs to consider these 4 things. I gave some suggestions here, but it needs to consider the opportunities. Will it opportunities for the community? So will they offer a stipend or payment for people to train? And this is widespread. We need to consider this, that there is a shortage of social workers and licensed clinicians in the greater Boston area. So it's really unrealistic to consider an intervention that's going to be clinician-led or fully clinician-led. And so are we talking about creating an intervention to create more crisis response workers? And in which case, how is Somerville going to pay people to train to fill those positions as like apprenticeship programs, for example? And this opportunity needs to be considered even more broadly than that. Is this going to be an intervention to educate the general Somerville population? Will it train a subset of the Somerville population as community responders? Or is the intervention going to focus on community leaders to then go on and train other general community members? This question about the stipend issue, and also how is the process going to be made public so that people know about the opportunity to train to be community responders? And going on training, what types of training would be necessary for an intervention? So I'm happy to send more information about how the Cambridge heart responders have been trained and who were the organizations that trained them. But some potential trainings include street medic training to address physical needs of individuals, as we discussed with mental health first in U medics in Chicago. Yeah, and I just want to pause there to say, I would love a question about liability here. So who should be responsible for malpractice if an alternative program is sued? I would appreciate that question and love the dialogue about it. But in general, the types of trainings, I listed some here: the street medic training, harm reduction, which is specifically around the issues of substance use supports, just in general trainings around the existing community resource. I would also recommend a community audit to get a sense of the organizations that make up the community safety ecosystem. General safety trainings, I know that there are organizations in the greater Boston area that do things that teach self-defense training, but they also help design protocols for organizations to understand how to address specifically domestic interventions. So if a responder is in someone's home and things turn violent, there are organizations that train community responders in those situations. What are the tools that the intervention practitioners need? I really recommend a community resource map. Again, this audit of community resources is necessary. Other tools that a responder may have in the field would be the process of pod mapping, identifying resources that an individual has to address their own needs. Community dialogue spaces. Organizations already facilitate community dialogue spaces. How do we make sure that community members know about these dialogue spaces? How do we better resource these spaces? How do we know that once a community dialogue space is happening, that they can refer people to other existing services and resources? And other types of tools include materials and administrative resources. So there are a range of different tools that need to be considered for an intervention.
Stephanie, right. I'm sorry, you got your wish around the question. Do people who participate as alternative response employees have to sign any legal waivers or consent forms to mitigate liability risk?
Yeah, in order to answer that question, I want to refer back to one of the earliest questions that we posed when having this discussion, which is who will the responders be and where will they be housed, right? So if we have a police-led intervention or alternative, then the police are a department of the city, and so the city is going to be sued for malpractice, right? And so then the city is responsible for paying out any malpractice suits that are that go through. If it's a service provider, then that service provider under Massachusetts tort law is liable up to a certain percentage. And then typically that organization would have insurance to cover the difference. And if it's an individual, who isn't paid, so like training community members to be responders, they're protected by the Good Samaritan law in Massachusetts and cannot be sued if they're attempting to be to support someone in need during a time of crisis. And so it really does matter where the intervention is being housed for this specific reason.
Thank you.
Yeah. Lastly, I want to talk about the powers, and I think this is crucial in the discussion, the types of powers an intervention needs to consider and designate to responders. So the power to coordinate spaces, police, for example, have the opportunity to court off spaces when they're facilitating an intervention. So putting barriers up, preventing people access to a space when there's some sort of crisis or violence taking place. Other powers include facilitating the distribution of resources. Sorry, the distribution of resources, being able to give out the materials that are needed. The opportunity to develop and facilitate community accountability spaces. So we talked about dialogue, community dialogue spaces, making sure that those things exist for people. So for example, let's say I have a partner and my partner and I are in conflict. If we could seek a space to facilitate our dialogue, that's a potential intervention, and making those spaces available for people is a power that we could give to a responder. A big one would also be designating residency. There's this conflation of how it is we can track who is being served. So the city of Somerville would want to make sure that an intervention that's housed at a service provider in a nonprofit is serving Somerville residents, right? But our unhoused populations considered Somerville residents, that's a bit complicated. What about undocumented residents who do live in Somerville, but they have no proof of residency? So being able, for the purposes of their interventions, to be able to designate residency might be crucial for a community responder. Does that make sense?
Yes, absolutely.
All right, cool. I'm gonna move on to the next one, but feel free to ask questions about this at any point.
Thank you.
So city governments cannot develop comprehensive alternatives without partnerships with organizations that make up the community safety ecosystem. So I've made this list of some types of organizations that make up a community safety ecosystem. And so I've listed them here. Food pantries, housing providers, unions, existing warm lines, language justice organizations are like translation services. And I also, you might have noticed that I put gangs on this list, and I want to name them as a crucial point. You cannot end gang violence without members of gangs themselves and being in dialogue with members of gangs themselves. So I'm naming the gangs themselves. And if you have questions about that, I would love to be asked why they're here. Right. Okay. So as you can see, there are a lot of existing nonprofits, and some service providers already operating in Somerville and are already facilitating a number of different responses. And alternatives to community safety are about properly designing the interventions to address the root causes of harm, implementing interventions at full scale. I want to reiterate, full scale, and fully resourced and resourced capacity to meet the goals of the interventions themselves. Developing a monitoring and evaluation plan that allows the program and the stakeholders, and in this case, the stakeholders being organizations as well as the people they serve, not just the funders, to understand what it is and isn't about working in an intervention and its approach. And it's also about the structure of the relationship between the government entity, the organization, and the community members served by the program. It's also about the accountability structure between the government entity and organizations and the community members. And by accountability structure, I do very much mean developing that this needs to be crucial in the development phase of what the intervention will do and how it will be implemented and how it will be communicated to every stakeholder. And we obviously need to think about the program itself, right? The principles and the values of the entity that houses the intervention. And lastly, it's about the structure of communication between the government, the organization, and the community members. So how are we going to get information out to people? In the community process that led to the HEART model, what we talked about was creating a quasi non-governmental organization. So that is housing a program in a separate nonprofit 501c3. And this solution, the reason why the community members chose that was because of the liability question. So that the organization would have limited liability for malpractice and could get insurance to insure the organization if there was malpractice. However, the question of communication between stakeholders was an issue, and the proposed solution to that issue was that the city would create a separate administrative, purely clerical department that would facilitate communication. So the example that we got was from the Eugene, Oregon government has a communications department that strictly deals with communications around their relationship with the Cahoots program, which is housed at the White Bird Clinic, which is a separate 501c3. And so what they do is anyone who seeks to learn about the city's relationship with Cahoots, they would be able to contact that department. That department also has information about the contracts between the city and Cahoots. And they also host regular community safety hearings where Cahoots speaks about their impact and the work that they do. And so we were proposing a very similar communication model for how Cambridge HEART might be able to work with the city of Cambridge. And this is something that needs to be really clearly considered in Somerville. All right. We're in the home stretch. Last thing. Before I conclude, I want to address the fact that the city of Somerville recently approved 2 new jail diversion positions in core and a social worker for the libraries to be supervised by the Somerville Health and Human Services Department. So I didn't initially address jail diversion programs in this presentation. However, I think it's very important to consider the next steps very carefully. While the positions may be named jail diversion, and indeed any model that I've presented here can be considered or can be seen through a jail diversion lens, it still remains unclear what the positions will ultimately do in Somerville. So if Somerville employs a hub model approach, for example, the first model that we discussed, jail diversion positions could be the conveners of the table, for example, so that it could be a government-led intervention program. And if you employ a targeted population intervention, this position can facilitate the research process, for example. But it's really important to note that these 2 positions are not the interventions themselves, right? The intervention development process needs to still be considered, and all of the questions that I've laid out throughout this presentation still need to be answered. So thank you for having me, and I look forward to answering any further questions.
Thank you, Stephanie. We do have some additional questions from our constituents.
I have a quick question, Denise, if you don't mind. As a data person, I saw you talking about how to evaluate these programs. Are there any key data points that you can point to that might point to the success of an alternative response program?
Yeah, that's such a great question. Copy and paste answer to this. I really want to reiterate that the process for what the intervention needs to do is key in developing a monitoring and evaluation plan for an intervention. And that the key performance indicators need to be very specifically focused to the point of intervention. So once Somerville decides what the intervention will be, that needs to be the process that develops the monitoring and evaluation plan, if that makes sense.
Thank you, Liz. That was a very good question. Here we are. So the question that we have from our constituents, what are some measures of success for an alternative response or emergency response program?
I mean, the biggest thing is for it to do what it seeks to do, right? If we're talking about ending violence, then maybe we have less violence, right? If we're talking about having people use the existing resources in Somerville, then we need to be able to, one, collect good data on the resources that exist in Somerville, and then two, take enough data over a period of time to see the growth in the take-up rates. So I can't really give a clear answer to that until I get a sense of what it is that Somerville residents wants the alternative to be able to accomplish.
So what are some of the biggest challenges or barriers that in your experience working in this industry and doing research that you have seen come up in creating emergency response models?
That is a beautiful question, Denise. There's two things that I've seen. I'll be really candid about this. The first thing is that people want to copy and paste an existing program into their city. So they've seen somebody else has a thing, let's just bring that thing to Somerville, without considering, I don't know, the population of Somerville, or considering the languages that need to be spoken, or considering that people use this thing here and that they don't use that thing there, or that Somerville already has a thing that already does this thing. So you can't copy and paste somebody else's program and just think that it's gonna fulfill just a goal. So I just really want to push Somerville not to do that. I think it's a real waste of money to just say we want a thing because another place has it and then just copy and paste it into Somerville. The second thing is that I have these conversations with different communities around designing alternative programs. I keep reiterating the point that there needs to be a process for identifying what needs to be done. And the question that is often asked of me, and I want to point out that I have zero power in some of them. I don't have a say in what happens, but people, I've heard it said like this, and I really liked it. You know, people ask me the question, what is the length of a piece of string? So I want to call, somebody who pointed this way. So what is the length of a piece of string? Well, I need to know what the string needs to do in order to tell you how long it needs to be. And I think that's the crucial thing, the process for determining what needs to be done. And then consensus on that, getting some information about like how many resources and what types of resources does Somerville have to devote to creating this sort of intervention, and then working to develop it and implement it properly and to capacity and not quickly. I think a lot of people really want things to be done very quickly rather than thinking, okay, if this thing is going to accomplish a goal, it needs time to be implemented correctly to make sure that the right people are in the right positions to make sure that it actually facilitates the goal. Sorry, I have a lot of thoughts on this subject, but thank you. That was a great question.
So could you, one of the things that does come up in conversation around emergency response models is that it's not just about responding in the moment. It's definitely also about keeping interventions in place that could help who's being responded to in aftercare. So that's assuming that they want the aftercare, right? So how do what suggestions would you have for working with community members who may deny or refuse aftercare?
I mean, I really encourage a process that's specifically targeted to collecting data from that community, from that subset of community members. So I personally couldn't speak to the needs of, I don't know, undocumented community members at the moment, because I'm not currently undocumented, right? But if there is an organization that serves undocumented community members, maybe Somerville can employ them to facilitate a process to ask them, why wouldn't an undocumented community member want aftercare? And that process could yield a number of different things that could be useful for determining how to go forward. So I don't know, off the top of my head, I would think, well, it really depends on who's facilitating the aftercare. If we're sending social workers who are mandated reporters to undocumented people's houses to facilitate aftercare, then they might opt out, right? If we're only sending English only speakers to facilitate aftercare, there may be people who are non-native English speakers or don't have a translator present, would not even understand to ask for that. So there are a number of different points that need to be considered, and the best people to tell you what those points are those community members themselves.
Was that mute? Thank you, Stephanie. And we are coming down to the last few minutes of our webinar. This has been absolutely amazing and enriching. I wanted to, before you give us your final comments, I wanted to ask you if you had any advice for the Public Safety for All Task Force that is currently taking a look at the information around what the community needs and concerns are and what the data is telling them about Somerville. Do you have any tips for them as they embark on this journey to take a look at what, if any, in combination or separately, emergency response models are necessary and could be implemented in Somerville?
Yeah, that's another great question to me. The biggest tip I think that I've already said and I'll reiterate is that Somerville doesn't need to reinvent the wheel. It's crucial that the city does an audit of existing resources in the city, and sort of map out the community safety ecosystem. So if Somerville has lots and lots of great resources already, it's really a question of figuring out what is already here. How do we make them work to their full capacity? How do we improve communication between them and the people they seek to serve and the people who need their services? And what role does the city of Somerville as a government entity play in making all of that happen? I think if you guys start there, then the intervention is going to be a lot simpler to determine with the data that you're collecting from the individuals themselves. And the last tip I would add is that Somerville is not an island. It doesn't exist in a vacuum. It's really crucial to consider that although the city of Somerville considers the boundaries of the city as sort of fixed, individuals do not, specifically marginalized individuals do not. And the way that we all need to work together is thinking about how we, for example, can solve the housing crisis. It's not just Somerville only interventions, but thinking how can we work with Cambridge to address the housing crisis? And what does that mean for the people who want to stay put in the city of Somerville? Like they love Somerville and they want to go to the Fluff Festival. So and they don't want to move all the way to the other side of the state. So how does Somerville create the right set of resources and circumstances to allow people to remain in Somerville because they love it? I think that needs to be the crucial point that the task force needs to consider.
Thank you so much, Stephanie. And again, I want to remind our constituents that you have agreed to answer any questions that the task force may have and meet with them. And we are very grateful for you offering us your wisdom in this area. Do you have any final comments, something that you wanted a moment to share and didn't get a chance to because the question wasn't asked?
Let me take a look at some of the questions that I wanted to discuss. But in general, though, I think what I wanted to do was provide a series of questions that you all need to discuss, right? And so that's the first thing. And I really want to say that Somerville already does a lot of great things for Somerville residents, and that it's not an alternative doesn't need to be this massive onerous thing. It can really be, how do we help the people who aren't currently served properly by the existing resources that are there? And how do we make sure that the resources that are there are reaching the right people? I think those are the questions that I want to make sure that you all are asking. And I look forward to having more in-depth conversation with the task force around how other cities have answered these questions, and doing an analysis of the survey data to really look at what Somerville needs, so that we're crafting something that's right for Somerville. Those are my final thoughts.
Thank you, Stephanie. And I want to thank the RSJ team that is with us tonight, Elizabeth Ronan, who is our RSJ analyst, and Elijah Booker, who is our RSJ project specialist. Thank you, Stephanie. It is an honor to be able to do this a second time with you. Thank you all for your engagement this evening. To learn more about the Public Safety for All informational series and view past sessions in the series, you can visit somervillema.gov/PSFA. And as always, we encourage folks to visit us online on the somervillema.gov/RSJ, or on Facebook and Twitter as reflected on our screen. Have a good night, everyone. And we have put the information in the chat as well for your convenience. Thank you for joining us. My name is Denise Molina Capers, and I am the RSJ Department of Racial and Social Justice Department Director. Have a good night, everyone.